Welcome to the patient assessment scenario. In this training, you'll encounter a patient experiencing an unknown medical issue. Your task is to use your skills in assessment and critical thinking to determine the best course of action. As a first responder, every call presents a unique set of challenges. So take your time, gather information, and remember, your ability to assess accurately could make all the difference. If the timer's too fast initially, don't be afraid to pause the video to give yourself more time for thinking for the best improvements. Pausing and writing down your answers will always be the best way to learn. Fire dispatch to Medic 70. You are dispatched to a sick call of a male patient in a warehouse. The patient advises he feels diaphoretic and is requesting assistance. You arrive on scene and locate a warehouse building with the door on the outside. What two things do you need to consider as you approach the entrance? The correct answer is BSI, or body substance isolation, and scene safety. You put on your gloves before you exit the ambulance while inspecting the outside, noting that you don't see anything suspicious as you move forward. You enter the warehouse and locate a male patient, approximately 30 years old, grabbing onto his chest. He advises that he was working out 10 minutes ago when he started to feel a pain in his chest, his left arm, and his lower jaw. The patient appears diaphoretic, and he says he's never felt this way before and advises that his chest pain is a 10 out of 10. His pupils are at 3 millimeters. What is the next step in treating this patient? So for the next step, you want to gather your initial patient assessment, checking ABCs and also gathering vital signs on the patient. Your vitals are as follows. Blood pressure is 168/84. Heart rate is at 114. His SpO2 is at 91%. His respiratory rate is at 16. His temperature is at 98.4 degrees Fahrenheit, and his blood sugar is at 98. What are some differential diagnoses that we can gather just from this initial assessment? Some of the different differential diagnoses can be either angina, STEMI, or GERD. Besides medications, what are two interventions we may want to consider for this patient? Besides medications, you can consider performing a 12-lead EKG, and you can also establish an IV. You perform a 12-lead on your patient, and this is their rhythm. Do you see anything that's abnormal with this rhythm? In lead 2, 3, and AVF, we can see ST elevation. So, what are some medications that we can consider administering if the patient has no known allergies? Three medications we can consider, depending on your local protocol, is aspirin, which is generally going to be at 324 milligrams PO, oxygen via a nasal cannula at 2 liters per minute, and nitroglycerin. However, depending on your agency, you may also need an IV and saline established before you give nitroglycerin. It may only be an ALS intervention. You administer your medications and then you reassess the patient. But if these were our old vitals, what changes do you expect after administering aspirin, oxygen, and nitro? More specifically, what goes up, what goes down, and what stays generally around the same? After administering your medications, this is your new set of vital signs. Your blood pressure is 114/80, heart rate is at 104, their SpO2 is at 96%, their respiratory rate is at 18, their temperature is at 98.4, and their blood sugar is at 98. Your patient advises that with the administration of nitroglycerin sublingually, they have started to feel better. Their pain has decreased from a 10 out of 10 to a 4 out of 10. You may consider re-administering this drug every 3 to 5 minutes, 2 more times for a max dose of 1.2 milligrams total, depending on your local protocols or SOGs. Now, what is our patient's final diagnosis? From the information gathered, we should suspect that the patient is having a STEMI, ST elevation causing a myocardial infarction in the inferior leads, since 2 or more leads in the same area are presenting with ST elevation. Thank you all for watching this video. If you did like this, please like and comment. It shows me that people want to see more of this content, and I'll keep working on it. But anyway, I'll see you guys on the next one. See ya.